Hi, I'm Cathy. I'm the Associate Director of Nursing for Acute Services and the Integrated Ops Centre. So it's the people and the patients, but the culture of the place, the values that we bring, and really just that really close-knit community feel. I've worked in a bigger hospital and you just miss the links there, and this is what Hutt brings, and I think that's kudos why I'm still here, and I've been here for so many years. It's just got a really good natured feel. Everybody helps each other. You can walk along the corridor and you know everybody by first name. So my typical day would be that I would go and check in on the ops centre, find out what's going on in there, so what availability have we got with beds, use capacity planner, look at trend care, talk to the duty nurse managers and maybe troubleshoot throughout the day, looking at the next 24-48 hours. From there, I'll probably go to a few meetings, governance, meet one-on-one with the clinical nurse managers. I'm involved in a lot of projects, nursing. I've just been to a pressure injury group meeting, so that comes under nursing as a portfolio. I chair that meeting. So my day can be varied from day to day. So I like that. It's a challenge. I don't have any patient contact anymore, but I do enjoy actually being able to provide that leadership to nurses and giving them the support that they need. So I originally started Choosing Wisely when I was a clinical nurse manager in MAPU. I went to a Choosing Wisely symposium and brought back some of the ideas back into the clinical environment. So one of the initiatives was the PJ paralysis, which I know that quite a few people are now bringing on board, and that was through Addenbrooke's originally in the UK. So I got a bit of permission from them. And we've used some of their posters. So what's PJ paralysis? So PJ paralysis is around patients not being in a gown for as long as, as soon as they walk in. It's around getting them in their own clothes, getting that feel of actually you don't need to be in a gown. That's a waste. But also it's that feeling to a patient. If you're in a gown, oh, well, am I going for a procedure? No. Oh, well, I'm in a gown then. And so it's looking at actually what's best for the patient, rather than doing it as an automatic clinical need when actually it's not needed. We also know that there's 10% loss in somebody of bone when you actually just sat there, and that's come from the research that these guys have done originally. So patients who sit for long periods, obviously they've got more, they're not getting up and about, so their mobility decreases, they've got more increased pressure injury, they stay in hospital longer because they're not moving, they're not up and about, they're not healing, and so part of that was to get people moving.